I always find it as a tremendous privilege to be able to gain access to people's brains. It is really their mind, their soul, and what makes them who they are. I try to know the patient well, what their support system is like, what they do. Once I'm able to know them, then I know that I can care for them well. It is important to gain a trust, because they will need to have that confidence in me in order for me to provide appropriate care for them. I do general neurosurgery. It ranges from brain disorders to spinal disorders, mostly focusing on neurologic structures. We have anatomy, which is our structural brain, and our nerves, as well as our spinal cord. So any structural abnormality that occurs in the patient's body causing illness or suffering, we treat those conditions. We have patients that have very challenging and difficult problems, and that's probably the most difficult. Emotionally, I try to be empathetic with the patient. Prior to surgery, I usually prepare my patients by their images. I go through the studies with them. I educate them in terms of what the anatomy is like and what the abnormality is and how we go about correcting that. I always discuss with them what the different options are as well, and what the pros and cons of each of these options are. The technology that is involved in neurosurgery is tremendous. We are able to do things much more precisely and also in a less invasive manner. It brings me great joy to see a patient recover and improve their quality of life through what I have done for them.